and then we will take questions from the group. Do you want to go ahead and start?
Sure.
Okay.
Like I said, I'm Kelsey. I'm a physical therapist. I got my doctorate at the University of Miami. I graduated in 2015, so I'm closing in on that 10-year mark of practicing. I am the rehab director at Mars Hill Manor. It's an assisted living facility, and it's a great little community.
Hey everyone, Dr. Williams here. I am a professor here of Allied Health Science at Mars Hill University, and also in OT. I did my graduate work at Lenore University in Hickory, North Carolina, and then my doctorate at Chatham University in Pittsburgh. I've done pretty much everything you can think of except pediatrics with occupational therapy. So I've done just a staff OT, I've been a rehab director, area manager, and then I've been in corporate working with the clinical team. So I've done all of those different things, even home health. So I've got a good feel for all the different settings, again, except pediatrics. But I do love the field and love what I do. Even love it more now that I'm teaching, because that has always been a passion of mine. So happy to be here today.
Do either of you guys want to have any questions that you want to ask? So what would you say are some of the challenges that come along with the job that people applying might not realize at the start?
The first thing that comes to mind when you ask me that question is the ever-changing and evolving world of insurance, health insurance. I work in a geriatric care setting, so the main payer we're looking at is Medicare. However, it is moving in the direction of what we call managed care plans, and those are private healthcare companies that replace Medicare in a way. They pose a lot of challenges for getting folks on caseload. A lot of them require prior authorization, so once you get someone on caseload, you're then having to ask for visits, approval to see those patients, and they often have a copay associated with each visit, so that adds a financial burden to the patient. Whereas a lot of the times they want physical therapy, but then if they find out they've got to pay $25 each time, they're either they're gonna request to be seen less frequently or not at all. So that is one of the more challenging parts of my job as a rehab director is managing the health insurance plans.
I would second that. Just in my career of this year will be 15 years, I've seen the insurance realm change drastically, and she's right, it goes from a Medicare model where everything's covered 100% to these managed care plans, and they're marketed as these great plans, but when it comes down to it, when people actually need therapy and rehab, it's very limited on what they can get. So it can be very frustrating to be stipulated, well, this person doesn't want to pay the copay, so they only want to come a couple times. That's going to affect your outcomes and your progress. Also with that is basically understanding the differences there between all of those different ones, and knowing, like, if you have a Humana versus a Cigna or whatever else they are, stipulating how many minutes you can be seeing that person. So it might be they only will let you see them 23 minutes. And you can't get a whole lot done in 23 minutes, so that's tough too. So I always look forward to seeing patients who have standard Medicare, because I know that I have free reign to do whatever I need as long as I need. So that's something I look for, but I think we need to do a better job all around in this country in educating seniors, especially regarding the different Medicare plans and what their options are.
Okay.
Yeah.
So what has been like the best part about your guys' jobs?
I would say one of the best features of my job is the flexibility and autonomy that I have, and that's something you kind of work up to. You don't always get that as a new graduate. You have to prove yourself and grow some trust with your company or your staff, your team. But that is one of the nicer things about my position, and I say that because it's in contrast to a lot of my husband's the various jobs he's had where there's not that flexibility, and so I don't take it for granted. I do enjoy the one-on-one time. As much as some days I go, I just don't want to go see anybody today, I always end up enjoying it and spending that time with my niche is the geriatric setting. I say I love my old people. They can really just brighten your day, and you can learn a lot from them, and it's really cool to see the positive impact that just even spending that time with them can have. It's meaningful work.
Absolutely. I agree with you 100%. I would say for me, the best things have been seeing people make true progress from being completely incapacitated to 12 weeks later, 8 weeks later, whatever the time frame be, walk out of the facility or the community and be completely well again. It's a morale booster to see, not only for them, of course, but also for all the rehab staff who've worked very hard with that person to get them back to their prior level of function. So I think that is important to me. I also enjoy working with older adults. I originally wanted to go into pediatrics, but when I was doing my field work, I fell in love with the geriatric population. And I think the reason is because they are so wise. They have a lot of skilled trades that just aren't around anymore, and they have a full story of their entire life, where they're not to be viewed as a patient, they're to be viewed as a holistic individual. And if you take the time to get to know them and develop that relationship and that rapport with them, it is a lasting relationship, and it almost feels like their family. So, there's the inevitable of sometimes people pass away and things like that, but, looking back and thinking about all the relationships that I've created, it's very meaningful part of my career. And now I would say adding in being here and being able to educate future leaders in our field is very rewarding to me as well, in a different way. But I love seeing the excitement on students' faces and the excitement of when they get into graduate school and knowing that I've been on that part of the journey with them.
Okay. And then for those that are trying to decide between going to PT and OT, what would you say are the very key differences in helping them to make that decision?
Obviously, physical therapy is better. That is a great question, and I think it's largely going to depend on kind of the approach of how you want to work, but there is a lot of overlap too between the two. So I don't think anyone would make a decision to go one way or the other and regret it, immensely. I feel that physical therapy, we cover head to toe the entire body, so you get to treat the person. There's a lot more patients are willing to do physical therapy because they get it. They go, oh, this helps me walk, right? Where occupational therapy, a lot of times they're like, I'm retired, or I don't understand what occupational therapy is for. The doctorate portion of physical therapy, I think that was a pull for me. That was really one of the main reasons that I landed in the physical therapy world, because I was pre-med up until it came time to take the MCAT, and I realized organic chemistry and physics were not my thing. They were not my thing. I did my very best, but the light bulb never went off or on, with those subjects. But the physical therapy, there's so many ways that you can be a physical therapist, and I really enjoy that. You know, I've had, I've known folks, and a professor of mine that he, was recruited to work in the aquarium with some marine animals. Now, you're not billing as a physical therapist, but because of his knowledge of the way the bodies, muscles, bones, way anatomy works, he was able to do that. And I would say the variety of settings and different options you have. I really fell in love with the physical therapy world as a student. I don't think I knew really what I was starting when I began physical therapy school, but as I got into the program, I really, it opened up my eyes to all the different ways that you can be a physical therapist. So I don't know if I really answered that question, but that's my spiel.
Okay.
I think for me, I didn't know what OT was for a long time. And just like most people, when you hear that term occupational, you think of jobs. So now what I tell people when they ask is, OT is really helping people learn the skills for the jobs of living. And so we can do that in many different ways. Our scope of practice is huge. We have a OT practice framework that covers everything from being in the NICU with infants all the way till the end of life. And so for me, it's a creativity piece. I have a constant drive to be creative. I'm left-handed. I don't know if that has anything to do with it, but I love especially adapting environments for people who need to function better. We have the option of, working on strengthening range of motion and things like that as kind of preparatory activities, but ultimately we're looking towards an end goal. What are these specific daily occupations or daily jobs that these people need to know how to do, that we can get them back to that? So if there's someone who, for instance, has an amputation or something like that, their life is completely changed. So it's our job to help them figure out the best way to move forward and the best way to function through, maybe it's an orthotic, prosthetics, adaptive equipment, assistive devices, anything like that that can help them. And I love the fact that we can now bring in all these new technologies that we may have not had in the past. So OT really started, in World War II, going all the way back to when soldiers were injured, and they were finding that their mental health wasn't good. They weren't able to perform the daily occupations anymore because they were injured. So learning how it kind of evolved from the nursing profession and giving them meaningful occupations to do bettered their quality of life and made them feel like human beings again. So I think that for me is why I chose OT. And I love the overlap. I always tell people that imagine PT, OT, speech all in a row, and there's circles, and we have overlaps a lot with PT and speech. I also love the emotional and the mental health part of OT because we do a lot of cognitive therapy with people, which I enjoy. I'm a dementia practitioner, so I have a special place in my heart for those who have neurocognitive decline, and being able to help them throughout their journey with their disease and meeting them where they are, adapting their environment, and focusing on their strengths and not their weaknesses. Because if we do that, we can hopefully delay some of the other onset of the disease and prolong their life as long as possible with independence and occupation.
Okay.
Yeah, I would say sometimes I do get jealous of the OT world, or where they're able to if they have a goal for fine motor, they can color together or do art projects, and I could swing it, but they'd have to be standing when they did it, and I'd have to make it in a way that it's challenging their balance. Whereas sometimes OT will have goals for quality of life, and so they get to do these fun things, or gardening, where if I take someone out to the garden, it's we're working on balance, right? We're not working on gardening. So that's definitely, there's a pull there where there's, I think, a little more subjectivity in the OT world, where PT can be more objective.
But all three disciplines, really, I call it the trifecta: PT, OT, speech therapy. All three of them are truly needed in a lot of aspects of care, and I think with the trifecta or all three, people who have all three disciplines really end up doing the best. Because you take someone who's had a fall recently, there are aspects that PT is going to work on, there are aspects OT is going to work on, there are aspects that speech is going to work on, maybe some sequencing things going on there, adapting their environment, working on their balance and their ability to transfer, figuring out any of these factors that could be causing the increased risk for falls. So it's just really amazing to see the three disciplines, all different, work together towards the same common goal.
Nice.
Yeah.
So what advice would you give aspiring students for PT and OT?
I would say go in being open that, a lot of times a student will enter the program thinking they know what they want to do. I want to be, I want to work with athletes, or I want to, just be prepared to completely change which type of setting that you want to work in, because you get to learn so much about the profession, and you do clinical rotations, and you'll find what you're passionate about and where your strengths are highlighted. I would also advise potential students to keep in mind the cost of the program. I had a wonderful education and I had so much fun at the University of Miami, but the tuition compared to, let's say, Western Carolina is substantially different, and the cost of living substantially different. So that's definitely something to keep in mind when you're applying to programs or deciding which program you're going to accept, because your older self will thank you if you are looking at less debt.
I think for me, it's important to always keep an open mind. I think with us having the Allied Health Science program here, it allows students to really take some time throughout the undergraduate career to delve into these different disciplines and really focus on what they think is going to align best with their life, and what they want to establish as their career. I've had students start off with one discipline and then change to a different concentration, and that's completely fine. I wish that I would have had a major like this when I was in undergrad, but sadly we didn't have that then. But I think having an open mind and really thinking and researching and coming to me and asking questions. I have many different avenues where I can send you if I don't know the answers, but I think having that open mind is the most important thing. One of my classes in Capstone, one of the requirements is getting 30 hours of observation. And we've actually sent some to Mars Hill Manor, and they've been great with taking students from here, kind of developing that collaboration and partnership, so that students can actually see, the assisted living setting. It may not be for them, but at least they can see, what goes on there. But I've had students work in, various different places where I do have connections: pediatrics, skilled nursing facilities, assisted livings, independent livings, outpatient centers. So I think that's a part of the education that's great, because you actually are required to get the observation hours, which also would count for graduate school. I think that pretty much covers it for me.
Okay. If there was one thing you could go back in time and kind of change, whether it was during graduate school, undergrad, just early part of your career, would there be something you did differently?
I sometimes regret, this was, as a student, our program would have extra courses that you could take, and they're like 6 to 9 at night. And there was one in particular, like myofascial release, that we covered it in school, but it was like a more in-depth, and it was optional, it's free as a student, but by the end of the day at 5 o'clock, I'm like, do I really want to go to another 3-hour, lecture or lesson? And so I didn't take advantage of all the additional courses that were offered, and so I do sometimes regret that, because now I'm like, oh, I really wish I had, just sucked it up and did that. But professionally, I feel very fortunate that I think I've made educated moves in where I ultimately decided to work. I was fortunate to find nonprofit positions, which is very important when it comes to my student loans. And yeah, I don't have any regrets, big ones at least.
Okay.
I think for me, I wish I would have known about the field earlier. Back when I was in high school and everything, we just didn't have a whole lot as far as information about different fields we could go into. We had the general, like attorney, medical doctor, those sort of things, but we didn't know about these little other fields we could go into. So I didn't become an OT till I was 26, and I had a previous careers before that. So I don't regret anything in my life because it's made me who I am and where I am today. But I think I would have probably gotten into the field a little bit earlier and been done sooner. So that's probably the biggest thing. I've always tried to keep that open mind and knowing that in our field you can pretty much find a job anywhere in the United States and really anywhere across the world. There's always going to be a need for rehabilitation. There's always going to be people with disease and injury, and that's one great thing is you can pretty much move anywhere and find really good jobs. And if you don't like a job for some reason, then you don't have to stay there. There are many options for you. You can change fields completely. I've known therapists that would be in geriatrics and they would switch roles and go to peds, or vice versa. So that's another cool thing is that there's so many different settings that you can work in. So I think those are the major things for me.
Okay. And for PT and OT with graduate program, and if you have to do any residency or anything after, how long did that all take you to do?
So after graduating from undergrad, the PT program was 3 years, 3 semesters a year. And my program literally started the day after I walked, got my diploma for undergrad. So it was packed up the car and went and started the next day. So it was very all straight through. What was the question?
If you had any like residency or anything after that you also had to do?
So there's a lot of, or there's quite a few different specialties that you can go into as a physical therapist. Unfortunately, right now, the way the health profession field is set up, other than your own personal knowledge and getting that experience and specializing in something, there's not much incentive to do the residency, at least in my experience, where if you're looking to apply for a job, that might get you a position before the next person, but is not going to significantly change your compensation, at least in my experience or the settings that I work in. If you're looking to get a very specific job somewhere and and that's a requirement or something that's going to give you a leg up, I would look more into it, but I haven't pursued a residency for that reason.
So for OT school, after you graduate from your undergrad, mine was 3 years. We had a lot of breaks in the summertime and so forth. So going through and passing all of your classes, very, very important. Always being present, always being on time, very important. And I think we did like 2 8-week rotations and then, no, 2 2-week rotations and 2 12-week rotations. So those could be in your fields of choice, but they had to be different settings. So for instance, I did a pediatric one I did a home health one, and I did an outpatient shoulder, and then a skilled nursing. So those were the main ones I wanted to kind of see and fill out a little bit. But I was lucky enough to be in a upper extremity outpatient clinic, so I got a lot of hands-on with shoulder rehab, elbow, wrist, hands therapy, which was very important to me, and I think not all OTs get that, so I'm glad that I got that experience. But after you finish that and graduate from the university, then you can sit for your national board exam, just like PT. And once you pass that, you are ready to go. You just have to pay for your state license. So your national board basically covers you for anywhere in the entire country, and then your L or your license would be for the state in which you work. So a total of 3 years. That field work is embedded in the classwork time, or kind of in that period where you're in graduate school. But once you hit that graduation mark, you have your degree from the accredited university, you can then apply to take that national board exam. Once you get that state license, you're ready to practice. So, all in all, around 3 years and a couple months. But a lot of those 3 years is very, very intense and busy and filled with lots of study, lots of field work, lots of documentation, and just preparing yourself for the next step of your journey.
Yeah, I had to wait a couple months to take my boards after graduation.
Yeah, I waited too, because I needed to study.
And then one of the scariest things about taking the boards, besides the fact that you're taking the boards, is that if you don't pass, you have to wait. I think it has to be another 6 months before you can take it
and
again.
pay an extra, what, $500?
Yeah, forget the financial, but I was so freaked out at the idea of being unemployed for another 6 months, and then I don't remember the exact rule, but if you don't pass again, I don't know if it's a second fail or if it's a third fail, you have to completely go through another 3-year program before you're eligible to take the boards again. And I think at that point, you're just do something else, right? But I just remember.
OT might be a little bit different. I'm not sure of the maximum number you can take, but I know it's more than 2.
Yeah.
But there always is that fear. When I took the board exam, it took 2 weeks to get the results back.
Yeah.
So imagine waiting that long. Kind of like you used to have to wait for a blood test result for 2 weeks, but now you pretty much get your results back the same day, which is great. And you don't have that anxiety and that fear and not being able to sleep at night because you don't know if you passed. But I think everybody has that fear they're not going to pass. But if you've really paid attention and participated and engaged in your program, and it's really what you want to do, I think you won't have any problem.
What was the hardest course in graduate school for both of you guys?
Mine was the very first semester. It was the anatomy course. It was cadaver lab, where there was, I think we had 3 or 4 students per body when you're doing dissections, which was not my favorite thing in the world.
Very different than models.
Yeah, I was gonna say I still kind of think I could have learned just as much, if not more, from a synthetic body, if you will, because a lot of times by the time you're seeing that individual, that body, their muscles are atrophied to the point you're just tissue paper, and there's a lot of adipose tissue, and but the reason that class was so hard was the test format. It was you enter the room, things would be tagged on the body, you have a minute for each question, the timer goes off, you move on, you can't go back. So if you're not a great test taker like myself, and you just have a brain fart, right, you can't think of that answer for that question, and you can't get rid of that thought, you keep thinking about it, it can be really, that was very stressful for me, right, the boop, move on, you can't go back. And so that's why that class was so hard, where I was freaked out I was gonna fail out of the program. We did have, I think, 3 students failed out of the program that semester, and you talk about, what do I do now, right? Because I've signed a year-long lease, in Miami, and this is, so a lot of stress that first semester, but.
So we had
I
practicals just like that
Yeah.
in OT school. So that's why I've kind of followed that example. So I have them start that here.
Good,
So
yeah.
they get anywhere from 1.5 to 2 minutes here to do that, to
Yeah.
kind of prepare them, because I know that it's coming in the future.
Yes, yes.
I would say the hardest class for me was probably neuroanatomy. Musculoskeletal was a lot easier for me. But the neurology it can be a tough subject. We do go into the neuro stuff here, but not as near as in depth as what you'll get into in graduate school. It's quite complex. So I think probably that was hard for me. And then we had a class called scientific inquiry, which was a lot about research, where we did a thesis. So I got a good opportunity to write a master's thesis that was about 100 pages, and we had it bound, and we felt special and everything. I thought that was something, but then I had to write my dissertation, which was like 200 some pages. So a lot of work there, but something that you're always proud of and that you always have as a keepsake. But I would say those two classes for me were probably the hardest, because they required the most study and work, I think.
Okay. And then last question from me, but what would you recommend students take advantage of as an undergraduate student?
I guess I touched on that when I was talking about like going back in time. Is take advantage of extra things that are offered to you. Anything that you can get that's included in your tuition, take advantage of that. Get out there, volunteer or like observe. Put yourself out there. Try to network. I mean, it really can pay off. I strongly believe that the reason I was accepted to the University of Miami is because I held the elevator door for the woman that ended up interviewing me. It was just, and so we had like a little exchange in the elevator, and I said, oh yeah, I'm nervous, I got an interview today, and she's like, okay, good luck. And then when I get called back, it's her, and it's like, yes, but yeah, like just put yourself out there, meet people, get to know the field and people working in it.
So I think for me, it's important to, again, stay open-minded, be involved as much as you can, like Kelsey said. Take advantage of what the school offers as far as things like clubs and activities. By the way, we need more people to come to this club, so please join us when we do meet. We're doing all these things for you guys to help with your futures. So I think that's important. Also take advantage, especially if you're wanting to go into like a medical role, maybe you can get like a part-time job in something related to that. So we're talking about PT and OT today. There are jobs called PT aid, OT aid. You don't have to have any specific formal training for those. Sometimes it's mainly like a GED or a high school diploma. So going in and working with therapists on a daily basis and therapy assistants is a great way to immerse yourself in the field and learn more about and just watch what goes on a day-to-day basis. So that's something I always recommend, and it also can count towards your hours for your capstone class if you're working in something like that. But it gives you a really good background, and also that looks great on an application to grad school. If you've been a PT aide or an OT aide or a therapy tech as another role that you can look for, that's going to look really good when you're applying to school, because you've had all that experience already. And I know that it's more clerical or more administrative, but you're still getting to like set up for treatments for therapists and kind of clean up, so you're getting to watch a lot of different things going on. So I think that's important.
Yeah, totally agreed.
Mm-hmm.
If there are any of those jobs anymore.
There are in like larger places,
Yeah.
But back when I started, we had them in every single day.
Yeah, I remember those days.
So.